Welcome to Legal 123s with ByrdAdatto. Legal issues simplified through real client stories and real-world experiences. Creating simplicity in 3, 2, 1.
Welcome back to another episode of Legal 123s with ByrdAdatto. I'm your host, ByrdAdatto, with my co-host, Michael Byrd.
Thanks, Brad. As a business and healthcare law firm, we meet a lot of interesting people and learn some amazing stories. We're really excited today because we're going to talk with our friend and client, Dr. Jarrod Frank, who lives in Manhattan and is trying to run a business and also going to share with us his journey with coronavirus.
And before we get Paul, bring him in, Michael, I have a seemingly random question for you. What does the Guinness Book of World Records list as the most successful female recording artist of all time? And I'll give you a hint. She has sold over 200 million records.
Well, Brad, I know you know my age. I grew up in the 80s, so this is super easy. The Queen of Pop, Madonna.
Yes, you're correct, sir.
And so I would love right now to introduce my good friend Paul Frank, Dr. Jarrod Frank. He is a dermatologist in Manhattan. He was born and raised in Manhattan, went to New York Medical College. His training is in New York. He has a practice with traditional dermatology and cosmetic dermatology. And of note to my teenage daughters, he has 134,000 followers on Instagram. He is certified, which makes you not only legit, but famous.
Really legit.
But here's the thing, and what I think is the common bond that we all formed beyond just a normal attorney-client relationship, is that all of this is grounded in training and education. And that's our passion as well. And so if you follow Paul on Instagram, everything is going to be grounded about learning about his craft. And so I'm really excited to have him with us today. So, Paul, welcome.
Hey, guys. With an intro like that, I think we should do this weekly.
Okay, so I know this. Tell us, how in the world did you end up doing business with Madonna?
Oh, well, you went straight to the juice, didn't you? Wow, look at that. Usually interviewers, they socialize a little bit first. Okay, you're good on a first date. I mean, truthfully, it was an unfortunate thing originally because she had worked with a very prominent dermatologist, Dr. Frederick Brand, for years prior to me. Unfortunately, he had passed about 5.5. It's about almost 6 years ago now, 5 or 6 years ago. She came to, so obviously she was without a dermatologist for some time. And she came to me through another patient, a friend of hers that was a client of mine. She reached out to me, we consulted and put me through the test a little bit. We spent some time together and we expanded our relationship, not only a doctor-patient relationship, but then on to other business endeavors like a skincare line.
And so you're a child of the 80s as well, right?
Oh my God. Yeah, no, it definitely was not something that I thought was going to come of my life. Like a lot of things, including getting COVID and a lot of, the number one thing I've learned through everything in life and in medicine is be prepared for change and never say never, right?
The dreaded line in the sand does not end up well whenever we think we're never going to do something.
That is for certain.
Well, so as we kind of transition in, we talked a little bit about the training and education. I would love for you to kind of share some of your passion about training and education and why you think it's so important and taking it to your social media.
Well, the good news and the bad news is that the field of aesthetic medicine has exponentially developed over the last decade. It's gone from something that only like ladies at lunch do to a wide spectrum of genders, orientation, skin color, socioeconomic class. It's really it's become like a form of grooming to some ways. And the good news from that is that everyone has the access and ability to look and feel their very best. And the business is growing for the providers who perform the services. The problem is these are not getting haircuts it's not getting your nails done or bikini wax. This is still the practice of medicine. And with the dramatic expansion of the aesthetic industry, education is the most important thing, because the consumers only know about what they see on the internet, in the newspapers, and the magazines, and it tends not to always be the real deal. So for me, I really think that the first step in my business is to make sure I can educate my consumer, and those are my patients, so that they understand not only what can be done, but the risks and benefits. And I think this is just as part of the push and shove about the expansion of the field of aesthetic medicine.
Yeah, no, I love the fact, and I think, Paul, your point, we see this a lot, obviously, from just engaging with clients in different areas, but understanding that this is the practice of medicine. And because so many entrepreneurs have entered into this space that don't have that background, they have zero background in medicine, but they may have a background at Dillard's or some other line of that has other entrepreneurial gyms or whatnot. And they just think they can jump into it, and by out advertising or out marketing everyone, they can get those patients in there. But what I've loved about following you also is that it's not just that you have those followers, but you're actually educating them on it and explaining the differences between these type of services.
And I'm glad you said it first, but yes, there is an entrepreneurial edge and growth in our field. And as I say, pigeons always go where the crumbs are, right? So you not only have physicians, but you nurses, PAs, estheticians, medical assistants, which have various licensure and ability to do different things in different states. You also have private equity going into all these things. And unfortunately, at times it could be the Wild West. And the consumers can be very confused about not only who may be good at a procedure, but also who can legally do these things. And we could talk, once we get to COVID, we could talk about what the consolidation of the industry may be too. What's going on in the world may not be such a bad thing in the long run, because it may actually consolidate the industry to the people that have the strongest brands, education, and training in the begin with. So I'm hoping there may be some bright light at the end of this tunnel.
Yeah, you usually see in a recession that the people that don't make it tend to be, kind of the bottom end of whatever the industry is, and in this case, that may be good for patient safety because we're talking about medical care.
Yeah. Well, when you start getting into the practice of medicine in a price war, like the cheapest Botox, the cheapest laser, the cheapest, that's when you're really starting to cause the problems. And a lot of these, the competition and the growth where there are low margins and high volume and the quality of care may not be, these are going to be the first types of businesses that may not survive whatever recession we're going into. And this is something I tell my peers, because I'm 50 years old. I certainly have mentors that are older than me, and I have students that are younger than me. And one of the common threads that other physicians will say to me is like, God, you're so positive about the growth of the industry. And I always say, like, a lot of people will be like, oh, there's so many med spas and non-physicians doing procedures and private equity. And it makes it really tough to grow your practice in a time like this as a legitimate board certified physician. And I said, well, the good news is there are a lot more people eating the pie, but the pie is so much bigger than it was when I opened my practice 2 months before 9/11. It was still a little bit more of the ladies that lunched population out there. You weren't having 25-year-olds coming in for things. There certainly weren't men doing these things. So I say that's the good news. And I said, the way you're going to continue to grow your practice is through letting people know the education and training required to provide the service. And that's how you're going to grow your practice with this level of competition that's out there.
And when it comes to training, obviously, besides what do you do internally with your staff to help train them?
Well, we're pretty vigorous, and again, I'm not anti PAs or anti-nurse providers or injectors. I just believe they have to be trained right and supervised appropriately. They shouldn't be supervised by a CEO of a business. They need to be supervised by a hierarchy of care, just like you would in the hospital if you were getting your gallbladder removed. There's a senior surgeon, there are residents, there are fellows, there are nurses. There's a coordination of healthcare providers to give an appropriate care, and everyone has a role. And we quarterly do training sessions. We work with all the laser companies and the injectable companies. Anyone that comes to work at P. Frank MD, they don't touch a syringe or a laser until they spend at least 3 months, like on my side, like literally at my hip. Most of the providers that come to me, they do have some experience. They're not like straight out of school. I usually say I want, like for my PAs, I just hired more PAs. I want them to have at least 3 to 5 years in just plain general dermatology, right? You need to know the basics before you can do the cosmetics, because I think it's easy when everything goes well in aesthetic medicine. The real skill of a physician is when things go wrong. And no matter how good of a physician or provider you are, you do enough of anything, there are problems. So the real skill is determined in how to manage those things. So I like to make sure that people gain experience along the way with me.
That's awesome. And, you did mention when sometimes you run into problems. You kind of ran into a small problem recently, if you want to call it that. You're working in New York City, and New York City decides to start closing down medical practices, and somewhere along the way, you may have gotten COVID-19 by chance? Is that correct?
Got it. That's what they call it.
And so we'd love to hear, and we're very appreciative again for you coming and sharing your journey with it, because you're coming at it in a way which is amazing, because you have such a strong personality as to this is what we need to do to educate and train individuals, and you've taught and spoken many times. So you've spoken and taught many to different organizations, and your ability to share the story as to what is it like to be a patient or an individual with COVID-19, I think it's very impactful. So if you don't mind sharing, we'd love to hear it.
Well, I've learned now there are two types of COVID-19. There's the COVID-19 that's caused by the coronavirus, and then there's the COVID-19 that you gain from being at home for too long, eating baked goods and carbohydrates. And that's gonna be the boom in the liposuction portion of my practice, probably around holiday time, when people realize they can't shed all of that. But in regards to the COVID-19 that I suffered from, it's funny. Life hits you with a frying pan when you least expect it, both in good things and in bad things. I was very focused on getting as many. New York was starting to get fearful. There was ideas that it was about to start closing down, and then I got down to like the last week. I was thinking of things that most people thought of: my staff, my money, my business, finishing up with the patients that needed to get finished with. And I was very, very run down that last week, stressed out, like I'm sure everyone in New York was. And I was sleeping 2-3 hours a night. I wouldn't say I felt sick, but I was definitely, burning the candles at both ends that last week in many ways. Thursday, I think it was the 18th or 19th of March. That was the last day of work. I finished it. My family, because school was canceled, my family went to our weekend house in Long Island 10 days prior. So I wasn't around them during the last 10 days before the shutdown. And I was driving out, and I called my wife and I said, you know what, honey? I am so burnt. I don't feel good. Something's not right. I just want to be safe. Set up the guest bedroom for me. I'm going to just see how I do. And on the 19th, I woke up with 103.5 fever. I haven't had a fever in 3 or 4 years. I'm the guy that has the cold, and like all of us in the old world, we'd go to work if we didn't feel good, right? If you had a little cold or if you had a little something, that's what people used to do. They used to get on airplanes when they didn't feel right and things like that. I think maybe this will be another one of the golden lights that people just stay home when they don't feel well. So I woke up with 103.5 fever. And now this was still the middle of March. We didn't really know what the symptoms of COVID were. We assumed COVID-19 was a lung disease. So I called my personal doctor. He says, can you breathe? He said, I could breathe fine, but I have a piercing headache of 103.5 fever. I don't get that. And for the first 5 days, we didn't even think I had COVID, because that was just the nature. I thought I just was run down. I caught something. People get sick from a lot of things. I happened to have a pulse oximeter, because I'm a doctor, in the house. And I started feeling, I wouldn't say short of breath, but I knew my breathing was a little off. Probably about day 5, day 6, I put it on. And for those of you out there that don't know what normal is, 95 to 100 is a normal pulse ox. I was about 93. which is kind of like what a mild asthma wheeze would be. Okay. It's not dangerous, but it's a sign that something's not right. And I was like, oh, okay, this is going to be a problem. Within 24 hours, I started having significant breathing problems. It went down to the low 90s. And I'm about 8 days in, and I said to my wife, I love it out here. I've been in isolation. They were feeding me. I was like, I need to get near my hospital, Mount Sinai. Long Island has a hospital, Southampton Hospital. It was not the place I wanted to die. It's normally a place that didn't have an ICU. It was a hospital that didn't have an ICU. The closest ICU was at least an hour away, and I didn't know where this was going. I started feeling very, very fearful for the first time in my life. We went back to the city. Someone who worked for me risked their life for me and kind of protected their car, masked me, and drove me back into the city so that my family could travel separately in a different car safely. So thank you, Randy. Anyway, got me back. By the time I got back into the city, I was having significant problems. I was dipping into the high 80s. This is dangerous. Now, at the time, they didn't know how to care for patients in the hospital. People with breathing problems, they were intubating. And it's a longer conversation, but I think one of the things we've learned the most is how to treat breathing difficulties in COVID pneumonia patients. Back then, they were dealing with huge spurts of patients, and they were intubating a lot of people. And I decided I really did not want to go into the hospital from what my hospitalist friends were telling me with the levels of intubations. I got a nebulizer that asthmatics normally would get, and I got oxygen tanks from my surgically accredited office on the Upper East Side delivered to my home. And I used that oxygen and the nebulizers for 3 to 4 days of the most scary time of my life. I decided at day 12 to take hydroxychloroquine. Why I didn't take it earlier, I don't know. I was afraid. I was confused. And 24 hours later, I broke my 103 fever for the first time in 12 days. So was it the hydroxychloroquine? I don't know. It was probably my time. Am I regretful that I took it? I'm glad I took it. But you know what? That was just the beginning of the healing. By day 13, 14, my fever was broke. I was 10 pounds lighter. And for the first time in my life, I was like, I'm a 50-year-old healthy guy that works out 6 days a week with no prior medical problems. Unfortunately, I think I'm 20 years old. I work that way. I play that way. And this was the first frying pan in my life that really gave me a bit of terror and perspective. And people on the internet, at the time, this is like April 1st, you'd go on the web, you'd go on the internet, you'd go on the social media, and I really didn't hear of that many personal stories. It was almost like the beginning of the AIDS crisis. People were afraid to admit if they had it. You know what I mean? It was very, very weird. And there was a sense of fear of me to share the story. Oh my God, what did I do? If I exposed patients, what about my staff? Who do I call? Do I have to call everyone I've seen in the last month? There are so many confusing, conflicting things going on. And I said, you know what? The thing that's always done well for me in my publicity, in my social media, in my patients, in my family, and in my friends has always been to be as authentic and as explanatory as possible. And I decided to go online with my story about April 2nd, and there was just such a huge outpouring of appreciation and search for information and questions, and I became a COVID expert. I spent every day researching, learning, telling my story step by step, and I guess I got a few more fans out of that. That is you could tell I've told this story before, but that's basically the gist of it.
Wow. When you were in that scariest 3 or 4 days of your life, did you have a plan of like your oxygen, if it got to some level, you were going to go to the hospital?
I didn't want to be that stupid. I was treating at home like most doctors. We don't think we need other doctors, right? As long as I responded to nebulizers and oxygen, I was good. And I did. I would do nebulizers twice a day. And maybe for three or 4 days max, I would use the oxygen for 15, 20 minutes at a time, a few times a day. And as soon as I did the nebulizer and the oxygen, I'd go up to like 96%. And it would stay like that for like the next several hours. If I saw myself dipping, if I felt heaviness of breath, I would take the oxygen. So as long as I was responsive. Now, that was needless to say, I wasn't satisfied. I was terrified. I mean, I was writing letters to my children and my wife in my head. I really do believe that the coronavirus affects the nervous system psychologically, neurologically, in a way beyond just taste and smell. I had no issues with taste and smell. And even I lost 10 pounds. Thank God I had an appetite through most of it because I was eating. I mean, I was eating like a pint of ice cream a day to keep the weight on. I was just burning through 103.5 fever. So thank God I had the ability to eat. Unfortunately, I got used to the daily ice cream, which was a problem afterwards. But I lost 10 pounds and then I gained 15 back. But yeah, I was glad I was able to eat. I was glad I responded to therapy. And I do believe, I had problems with my vision and my hearing. But everyone I spoke to that had it, and believe me, I was DMing. I was trying to keep up with the DMs and the text answers. Many people, I got a lot of people, they can care less about neuromodulators and aesthetic medicine. They just saw that I was a resource of information and would follow. And everyone that I know that went through it to some degree, like I did, there was this feeling of terror, of the unknown. There was this fear. I can't use the word terror any other way because it's not just being nervous. It's not just being frightened. When I'm doing certain difficult cases, I get a little nervous and then I know how to manage my nerves and I get through the case. You know what I'm saying? This was a feeling of really not knowing what's going to come next. And I think it's actually telling people, understanding that is part of the healing process. Because once you know the problem, you could deal with it.
Wow. I mean, that you've shared that with me before and it's still so powerful to hear. And I can imagine.
And people are still getting it. And, even though we don't have a vaccine anytime soon, even though we don't have any proof that there's any one medicine that helps, I do believe the knowledge of the symptoms, knowing the fear, the insecurity that's involved in the process, I think that's helpful for people who may be coming down with it now badly. I also believe that the healthcare professionals dramatically have changed the way that they're treating patients. I think the threshold for putting people on intubation is much higher. I think they have a greater control of the situation and how to position people and how to treat them appropriately. So I think the care of COVID-19 is better even without the medicines that we're using. It's just the quality of care.
So let's pause for a moment. And when we come back from our commercial break, I'd love to explore what then became your new reality, which was trying to heal and recuperate back to your prior physical condition and reopening a business at the same time.
Many business owners use legal counsel as a last resort rather than as a proactive tool that can further their success. Why? For most, it's the fear of unknown legal costs. ByrdAdatto's Access Plus program makes it possible for you to get the ongoing legal assistance you need for one predictable monthly fee. That gives you unlimited phone and email access to the legal team, so you can receive feedback on legal concerns as they arise. Access Plus, a smarter, simpler way to access legal services. Find out more. Visit ByrdAdatto.com today.
Well, welcome back. And we just had we spent a lot of time with Paul. He gave us his in-depth conversation about what it was like to personally go through COVID-19. But as we kind of established early on, Paul is a lifelong resident of New York. And as that, we want to talk about not just the fact of what he went through, but as a physician in New York and now trying to get himself prepared to reopen, what are some of the things that he wants to start considering? And maybe Michael, you can jump in here.
Yeah, and then I'd love to even pick up a dialogue we were having, outside of the recording, and that's just, there is no shortage of opinions out there as to what physicians should do when they reopen, and the reality is that no one really knows, and so you have some people saying you got to test your patients and your staff and some not. And I just love to explore kind of your experiences in going through the reopening process and dialogue about that.
So just to give a little background for most people who may listen, I think everyone knows that New York was the most hardest hit place in the country. So there were certainly higher fear factor here than anywhere else. Even us watching the rest of the country starting to open up, everyone had their own opinions. I was able, because my practice is mostly aesthetic, we didn't open up as early as other doctors in New York, pediatricians, orthopedic neurologists, ophthalmologists. Obviously emergency care was being provided. OBGYNs were open. People were doing telemedicine, things of that nature. My business is really not possible to telemedicine. But we were able to open up our business around March 18th because our governor said that routine office visits were now allowed. So we did start opening up. It was almost like a soft opening before our true phase 1 started this past week. And, the good news is, as a physician's office, particularly as a surgically accredited facility, PPE is quite easy for us. I have nurses, PAs, experienced medical assistants, and even our receptionists who've been working for us for many years. They understand how to keep a place clean, how to keep it sterile, how to protect patients, and we're certainly very well staffed. So, I can only imagine what it's like to work to manage a grocery store or a bank where people don't have any experience in precautions. They're like wearing gloves, but they're shaking someone's hand and then touching their face with the gloves. Like, I've seen that. They think they're wearing gloves and that's okay. So, and listen, understand, I almost felt while I was recovering, there should be a medical professional service that goes to grocery stores, to retail shops, and gives, a day or two course in what sterile procedures may be. I think that's a valuable business. We should look into that.
Yes, yes.
Because it's something that's going to be a value down the line, because it's a new level of training that you're going to have to give, whether you work at Costco or Amazon or whatever. Anyway.
Well, this goes right back to your sweet spot, which is education and training.
Exactly. That's it. And I think, it not only makes my life easier, but it also builds my business, right? So this is what I tell other physicians: focus on those things. They've worked for you in the past. That's what's going to work for you in the future. So anyway, we went back to work, and, we were obviously, I started out as the only provider. I didn't have nurses doing procedures. I didn't have PAs doing procedures. Instead of seeing patients every 15 minutes, I saw every half hour. We put long breaks, and it really was quite good getting back. I always tell people to put them at ease, both my staff and patients, that the safest place you could be other than your home is in a doctor's office. I run a boutique practice. There were never more than 3 people in my waiting room ever. You know what I'm saying? So
Right.
Now that we cut it down to 2, it's wide open. This is a study. I'm not so sure if the rest of the country is familiar with this, but in New York State, Cuomo organized a study where they did testing of the general population and healthcare providers. And they showed, this was done, 6 weeks ago, 19% of the general population, with expanded, they tested like 20,000 people. 19% of the population had antibodies, had exposure. Only 13% of healthcare providers. So what does that tell us? It tells us wearing gloves, wearing a mask, wearing PPE works. It works really well. And it's probably safer than you taking a walk with a friend you shouldn't be taking a walk with, leaving your house during it. So I really use this with my staff, educating them to make them feel comfortable. There was difficulties with bringing certain staff back. Certain people didn't feel comfortable. I do have a lot of staff that have childcare issues, which I think is a really, really big problem all over the country. Daycares, schools, camps. I have 3 of my longest term employees, and they just honestly can't work full time. One can't work at all, and 2 can only work 3 days a week, not 5 days a week. And this is the problem, because I love my staff. I want them. I want to take care of them, but I also need to support my practice. So that's been the difficult thing, juggling staff. I have had some healthcare providers that have refused to come back even after phase 1, where I've had to go to the contract type of things. It's been very frustrating, and I'm just trying to do the best I can. But patients have been really appreciative, very respectful, And I think they've been enthusiastic to have P. Frank MD as part of their lives again. So that's really the great note. And I'm busy. I'm real busy. So I'm looking forward to the progress.
That's interesting. And in line with what we're hearing with our clients around the country, Paul, we had one client who on their 2 to 3 days before reopening went to talk to his staff to let them know kind of what the drill was going to be. And he ended up sitting with them for 4 hours because there was so much emotion and fear and questions about it. And what was interesting and what we're seeing with our other clients is that the mid-level providers who are used to working in an OR setting are not fearful because they're used to sterilization and all of these different protocols. The aesthetic providers that are doing injections are the ones where there's a lot of fear. And to a degree, I can understand that. But that has been thematically the biggest challenge we're seeing. And we're seeing patients that are excited to get back.
Yeah. And this goes back to the original education we talk about. Whether you're doing aesthetics, I mean, I'm in dermatology. Plenty of people could call acne an aesthetic condition. Plenty of people can consider psoriasis as an aesthetic condition as opposed to real, So, I mean, I do a lot of Botox and neuromodulators for migraines, for grinding of the teeth, for people who get rashes because they have excessive sweating. I do laser surgery on painful keloid scars. I do laser surgery on port wine stains on kids. So, in dermatology, there's a fine line between aesthetic and what's considered medically necessary. But we know in terms of the law, the practice of medicine is the practice of medicine. And my expectations and my responsibilities to my patients are the same, whether I'm injecting Botox for wrinkles or whether I'm giving them an intralesional cortisone shot for an infected cyst. And this is what I try and explain to my healthcare providers that may not only be nervous, but may be refusing to come in, that they have a healthcare responsibility. And that, I can't force people to do anything, but they have to understand how I view their responsibility to their patient.
Yeah, that's great.
I love it.
And I think the point that you made that, and Michael said it too, was that the hardest part is for people to understand that you try to treat healthy patients, and that's what your job is, in the sense that they're not coming there if they're sick or have a cough or have a flu. You're already trying to put parameters in place to prevent those people from coming. But because of the fact that someone could be asymptomatic, you do everything else you can do to prevent that person from coming to your office. And unless this person is going to stay locked in their house for the rest of their life, I mean, this is something that you're going to have to start figuring out how, if this is your job requires you to interact with a individual, there's certain risks that you're going to have to accept. And you said it correctly. It just is, look, I'm going to put you in the best position to protect you, but you're going to have to assume certain risks. And that's just part of your job in general.
That's what being a healthcare provider is. That's what being an attorney is. We carry a licensure that does carry some liability. That's why we all have insurance too, health insurance too. But it just does. It's the nature of the field. And when people forget that the practice of medicine does come with some controlled small degree of risk, either to the patient or to yourself, that's when that concerns me. Because again, training, education, licensure, these are the things how I always view things, even though people only know me for my cosmetic type treatments. And I think this is going to be the challenge moving forward. And hopefully, in the long run, everyone will have more respect for the type of quality and responsibility that all healthcare providers we have. I'm sure in most cities, like in New York, everyone's clapping at 7 o'clock. I know we do that in New York to thank the healthcare providers. And I know we did this during 9/11 to the first responders then too. But I hope that when this is all over, or we find the new normal, that the respect of the population it goes beyond just hand clapping, because we have to recognize what healthcare providers do for the greater community.
Well, on that note, Michael, I don't know what else I could add. I don't know if you have any follow-up thoughts, but that kind of, when I saw the mic hit the floor just now, Paul, it was pretty impressive.
it's hard to end with in any way to compare to that last statement. I will just leave one last comment that's an observation, is that we started at the beginning, in the middle, and the end talking about training and education. And I love how when you think about the problem that we face right now, which is fear by patients or fear by our employees, that the solution is the same thing. It is training and education.
Absolutely. And I'm going to try, and I always like the last word, but I want to thank you guys, because I know we've been working together long enough, and not only for building my business in the past, but also, without going into detail, the things that you've guided me on and helped me with to manage this crisis from a legal and from a business aspect. It has really complemented and allowed me to do what I need to focus on most, which is providing a healthcare service. So I want to thank both of you and your group for really always being there for me.
We're grateful for you.
Thanks again for joining us today. And remember, if you like this episode, please subscribe, make sure to give us a 5-star rating, and share with your friends.
You can also sign up for the ByrdAdatto newsletter by going to our website at ByrdAdatto.com.
ByrdAdatto is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Reference to any specific product or entity does not constitute an endorsement or recommendation by ByrdAdatto. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Please consult with an attorney on your legal issues.